Hi, come in and take a seat. I'm Dr. Matt, and something tells me this isn't your first cranial nerve examination. It's okay. We encourage people to be conscientious about their health here, so it's always a pleasure to see you. Sure. The test essentially comprises of an examination of your senses, so your eyes, your hearing, your sense of taste, smell, touch. Yeah. It'll last between 20 to 30 minutes. It really depends on how you respond and react to each of the examinations. There's nothing invasive. There's no injections. You can sit back and relax, and some people can actually enjoy a cranial nerve examination. It's been known, even if I'm the one conducting it. Yeah. Okay, we'll start by taking your heart rate. Sure. Nope, not at all. All I need you to do is just undo the top buttons of your shirt. And all I'm going to do here is just place this over your heart. Okay. Now what I want you to do for me is take a deep breath and release. Good. Good. Big deep breath. Okay, and continue to breathe normally, please. Okay. And again, I just like you to take a deep breath and release. Okay, and breathe normally. Okay, that's good. Now, other side. I'm just going to do just to your side here. It's a little bit cold. Deep breath in. And release. And continue to breathe normally, please. Okay. Okay. Now, if you could just spin round, I'm going to do your back as well, okay? I'm just going to place it in the center of your back, so we can hear your lungs as well. Okay. Just breathe normally, it's okay. Okay. That's good. Alright. And one more deep breath in, please. Really kind of expand your shoulders out. Okay. That's perfect. Okay. Good. Your heart rate sounds absolutely fine. Lungs sound healthy. I can hear absolutely no abnormalities. Everything is exactly as it should be, so no cause for concern there. Okay? Good. Alright. Now, I'm just going to pop on a pair of gloves here. Now, while I am not a dermatologist, I'm just going to have a quick look at your skin. All I'm going to be checking for is any redness, swelling, any breakouts that you would consider unusual. So I just want you to relax here. And I'm just gonna check the elasticity of your skin. Okay. You actually have very smooth skin. It's good to see you're getting enough water. Some people are lucky, some people can have impeccable skin and they never drink any water, at least not directly. Okay. Now, since I'm already inspecting the skin or the upper epidermis, what we're going to do here with me just 2 seconds. Okay. These 2 items here. This is a new cocktail stick, and this is a cotton bud. Now, each of these, I'm going to alternatively, or maybe at the same time, press against somewhere on the skin of your face, okay? One will feel very soft and very dull. This will feel, and it won't be uncomfortable, but it will feel a sharpness to it, okay? So sharp and blunt. I want you to tell me which one you experience. So just close your eyes, please. I'm going to change hands so you don't know which one, where it's coming from. Okay. Was that soft or sharp? Okay. Soft or sharp? Okay. Good. Very good. Good. Very good. A little bit tricksy sometimes. I'll try both. Yeah. Good. Keep your eyes closed. Good. Very good. 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 And one more. On your chin. Good. Very good. Now your little nerves in your face are responding exactly as they should. You had no issues identifying whether it was sharp or whether it was that soft edge. Very well done. Okay. Now, the next thing we're going to do is go through an examination on your sense of smell. Now, what I have here, 5 little spray bottles, and each of them contains a different scent. Now, it will be a foodstuff of some kind, or the flavor of a foodstuff, and all I'll be doing, I'll be spraying the contents onto this little cotton bud, and then just waving it under your nose and just getting that kind of waft, and tell me what you smell. Okay? Now, people don't often struggle to find these distinguishable. Okay, they should be quite distinct, and you shouldn't struggle too much. If you're finding that some of them or all of them smell very similar, I want to look at some kind of blockage in the sinuses, and we can go from there. It's just think of a cranial nerve examination as an early warning system. Okay? Good. Just a little shake. Okay. Again, you can keep your eyes open for this one because you can't know the contents of the bottles, whereas I do. Okay. Now, what does that smell like? Strawberries. Very good. Well done. Next one. What did that smell like? Good. Chocolate. Very well done. It's a personal favorite of mine. Okay. 3 more to go. And this one. Good. Rhubarb. Very well done. This is probably the most difficult one of the 5. But clearly there's no fooling you. Okay. Number 4. I have a habit of spraying water all over my surgery with this, so I need to try and be careful. Okay, number 4. What does that smell like? Very good. Very, very good. Orange. Okay. 5th and final smell. Take a smell. Bit tricky. Good. It's lavender. We always put a curveball in there. I told you. Yes. Okay. Now, the next thing we're going to do, and this is actually a fairly recent addition to the cranial nerve, and it's actually nothing to do with your cranial nerves. But the reason we include it in this examination is because it's becoming very frequent. It's becoming something that people are oblivious to. And all it is, it's a little lactose test. We have a little bottle of solution here, and it contains lactose. And we're just going to rub it on the back of your hand, and we're going to watch for a reaction. Lactose intolerance is becoming more and more common, or at least the awareness is becoming far more common. Okay? So all I'm going to do, if you could just give me your hand, please. Thank you. I'm just going to add a few drops onto the back of your hand. There we go. And we're just going to let this sit there for just a few seconds. Just rubbing it in a little bit. Okay. That's fine. Okay, good. It's always good to check. If you already knew beforehand, then that's fine. But for our records, it's always good to be sure. Okay? Alright. Now, what I'm going to do is have a little look inside each of your ears. Now, this little device here is going to project a little light. It's going to allow me to see into each one of your ears. I'm just going to be checking for blockages. After I actually visually inspect the ears, I'll be generating some sounds just to test that you can identify which side the sound is coming from and that you can hear it as you should be hearing it. Is that okay? Good. Now if you could just look straight ahead, please. I'm just going to look in your ear. Okay. Okay. That's good. That's good. I don't see any kind of blockage at all. Ear passage looks completely clean. A little bit, but not too much earwax, just as much as there should be. Just to keep the ear safe. There's a common misconception regarding earwax that the ear should always have a little bit of earwax because it prevents infection and little objects from getting too far into the inner canal. And of course, we come along with our Q-tips, our little, we push them in and we're pushing the earwax in further, and we're actually just causing our ear damage as opposed to enhancing our own hearing. Yes, these little things here should not be used by people for cleaning ears. I do not recommend that. The bane of an audiologist's existence, I assure you. Okay, I'm just going to check your other ear. Okay, and again, this is just a visual inspection of the ear canal. Ear canal, as I said, it makes sure that your eardrum stays protected. Very good. Very, very good. It looks completely clear again. No issues. Very, very happy with that. do here is just close your eyes once again. And all I'm going to do is make soft sounds next to each one of your ears. Okay? So I want you to tell me whether it's this side or this side. Close your eyes. Left or right. Very good. Good. Mm-hmm. Good. I tried to catch you out. Good. Now, what I want you to do here is keep your eyes closed. And I'm going to start with my hand next to your ear. And I'm going to gradually take my hand away. And I want you to tell me at what point the sound stops. Okay? Ready? Good. Same again. Very good. One more time. Now this is a little bit more complicated because they're going to start together but stop at different times. I want you to identify whether the left or the right stops first. Very, very good. Your hearing is absolutely perfect. And hearing, especially to somebody like me, and I'm sure to yourself, is really so important to us. And we take these things for granted, being able to hear and to see without issue. Then when an issue does come along and presents itself, we think, wow, I really took being in good health for granted. So that's why cranial nerve examinations are of the utmost importance, is to give us that check to make sure everything is running as it should. Very good. Okay. Now, we've done your ears. I'm going to have a quick look in your eyes. Alright? Now, all I want you to do here is look straight ahead. Okay, it's all you need to do. Good. Just look straight ahead. Now I want you to close your eyes really tight and then open them. I'm not going to be shining the light directly into them. I just want to be inspecting about how your pupils react to light, how they're yeah, exactly. Close your eyes and open. Good. 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 Very good. As I said, your pupils are reacting to light as they should. All I want to do here is really come quite close and just look at each one of your pupils. Okay? Okay. Alright, that's fine. Check the other eye. Okay, good. Your eyes, as I said, they look healthy, they're clear. The pupil is dilating exactly as it should. how is your vision? Do you ever wear glasses? Okay. Well, make sure that you are having your eyes tested on a somewhat regular basis, at least once a year. Yeah. Good. Okay. Now, what we're going to do now is have your eyes follow one of my fingers. It's a fairly simple exercise, and again, it's just testing the nerve and the muscle control of your eyes to make sure that you can follow all the way around your peripheral vision. Yeah, okay. What I want you to do is tell me which side you see a finger. Okay? Good. Very good. Mm-hmm. Good. Very good. Now, I want you to follow my finger with your eyes. Keep your head and your neck perfectly still. Just move your eyes. Good. Very good. Very good. Okay, that's perfect. Now, final test for your eyes. I just want you to identify to me how many fingers I'm holding up from your peripheral vision. Okay? Good. Start off with a difficult one. Good. And just the one side. Good. Good. Very good. Good. And one more. Good. Very, very good. Your eyes and peripheral vision are perfect. Well done. I'm just going to do one very, very quick test to see your blind spot. So, I want you to tell me if my finger disappears to you at any point while it's working its way down your line of vision. Okay, that was me cheating at 2 by finger at. You have complete vision? Good. Good. And again, just tell me if the finger falls out of your line of sight at any point. Good. Good. Your eyes are working exactly as they should be. Not that we expected anything less from you. Alright. Now, final test is testing your ability for your muscles to contract and unhold tension. So what I'd like you to do is take your hand and ball it into a fist. Now, I'm going to attempt to pry your fingers open. Don't let me, okay? Into a fist. I'm just going to try and, okay, fight. Good. And again, ball into a fist. Good. Now your other hand. Ball into a fist. Good. And again, tight. Don't let me open it. Very good. Okay. Now, I want you to hold your arms like this for me. And I want you to stop me pressing your arms down. So, hold them up. Very good. Okay. Well, the good news is you have a clean bill of health. You recognized the smell. Your eyes are reacting to light as they should. They can follow senses, can follow traces. You heard everything that you should. You knew the angle and direction. Resistance is fine. Your skin is looking very, very healthy. Yeah. Honestly, it's my absolute pleasure. I said we do promote people being conscientious about their health here, and it's far easier to prevent than it is to treat. Yeah, so if we can see something early, or if we can train ourselves to behave in such a way that's helping prevent, then absolutely. Absolutely. Okay, I'll let you be on your way. These results will be added to your profile that we have here, added to your medical records, and if you come back again in 6 months, then we can again elaborate from there. Absolutely. Yeah, and be sure to get your eyes checked. Okay? Thank you so much for coming in, and I will see you again very, very soon, I'm sure. Thanks. Goodbye. Take care.